All right. All right. Welcome to another episode of Vaginas and Vertebrae. We are super excited. I know you can't see me, but I am actually wearing my shirt, Vaginas and Vertebrae. How ironic is that? And I have a mug with a vagina on it, and my background says Vagina Doctor. I have a little bit of an issue, I think. But anyway, welcome to Vaginas and Vertebrae. This is Dr. Kaylee.
Dr. Madeline.
And we have another wonderful special guest on today that we're super excited. I think she said that this is her first podcast. Is that right?
Yeah.
I love taking people's podcast virginity. Like, that's my favorite thing because podcasts are so much fun. But we have Dr. Marissa. She's amazing. She's actually an animal chiropractor, but she's here to talk to us about her birth educating and what she does as a birth educator and all of that good stuff. But Dr. Marissa, tell us your story.
Oh my goodness. Okay. Well, I got into chiropractic school and I was very heavily indoctrinated into our Western medical model. So I went to chiropractic school because the promises of paying off your student loans fast and, regular normal hours versus the veterinarian I worked with who would be called out at 2 a.m. for calving issues. And I'm like, yeah, no, I don't want that. I'll just go to chiropractic school. It's fine. So I think even throughout most of chiropractic school, I was still so heavily indoctrinated into that Western medical model. So then to talk about the animal chiropractic quick, I guess, since it's part of my story, I have a dog that has seizures and in chiropractic school, I'm like, why don't I just get her adjusted? Adjustments stop the seizures. She hardly gets them ever. So I knew that's what I had to do. I was like, yes, animals need this too. So that's what I do. But funnily enough, I never wanted kids. I was not really interested in that. So, life has other plans for you, that's for sure. So despite my best efforts, we got pregnant with our first. And I did not want a hospital birth. I don't know what it was about that, but it just wasn't up my alley. So I'm also very opinionated, and so are other doctors. So I wanted my opinion to be I wanted my opinion to be the one that mattered most. So I found a midwife, and we clicked really well. And so that's how I got into the home birth path. And with Odin, that's my first, I was transferred to the hospital postpartum, and the doctor treated me pretty terribly, insulted me for having a home birth and didn't listen to what my midwife was saying about having a retained placenta. So he sent me home with a retained placenta. And so I just didn't feel like I was being heard and my health wasn't important in the hospital. And there's Barrett. Sorry, guys. So I felt really passionate about helping women at that point because I couldn't have been the only woman in a hospital setting being talked to like this and treated like this and not listened to and having treatment and diagnostic tools refused because the doctor knew better. So Barrett, sorry.
It's okay.
So that's where my interest in birth coaching, birth educating started. And then quickly after having Odin, I got pregnant with Barrett. Still was unsure about this whole pregnancy and having kids thing, but going for 2. So we're committed now. Yeah, we can't return you guys. And so chose another home birth because I'm crazy and was transferred again because I had a premature rupture of membranes. But that experience at the hospital was quite a bit different than my previous experience. Yeah, thank you. Barrett's telling you guys about it now. He was there.
Yeah. I like to hear his story too.
Yeah, what do you think? You weren't ready to come out, were you? No. So anyway, headed to the hospital and was on Pitocin for about 17 hours. Nurses were great. The doctors were very hands-off, which I appreciated. Of course, there were some things I wish I'd advocated for myself more. The use of antibiotics, being able to get off the fetal monitor once in a while to have more freedom of movement. But at that point, I think as women, I don't know if you guys relate to this at all, but I felt like I would let them have those little wins. So if it came down to having a C-section, I could fight for myself more because I was a compliant patient previously. Like I felt like I couldn't have a voice.
Oh yeah, that's such a powerful thing too. I hear that so frequently from my clients. And I think that that's really important because I tell my clients all the time, I'm like, you do have a voice, but then I have to always like step back and remind myself of natural desire to want to be compliant. You know what I mean? Like we all want to actually be seen as like the good student or the good patient. And it's kind of interesting that we're taking that into the birth too. So I love that you shared that. That's a really important part of your story. And would you say that that's probably like one of the main reasons why you advocate the way that you do is because of your own story?
Absolutely. Because I know I can't be the only woman out here trying to be compliant so that you can have the bigger wins later on. Like it's almost like a game we play with our healthcare, which no man would have that same issue at all. So why as women are we so like meek about our opinions, and we know our bodies, you know? So that's why I advocate for women the way I do and why I provide the support the way I do, because they need to have all the information in order to make empowered decisions, because you and your provider are equals in that aspect.
Yeah.
So, yeah.
Awesome. And I think that's really cool too, to make that empowered decision. I think right now we're in the midst of COVID still. I feel like I've said that the past like 6 weeks, but here we are still. The pandemic, we're still here. But I think it's so important to be talking about the home birth, because there's so much fear right now around giving birth during this pandemic, and so much fear around going to a hospital, which is 100% understandable. But it's also like, I get a lot of clients that'll come in, and Marissa, maybe you can speak to this, but I'll get a lot of clients that'll come in. It's almost like they've been told that they only have one option. So like, you have to do it this way, or
Absolutely.
you just give birth in the hospital. Like when I was raised as a child, I didn't think that there was a thing called home birth. I didn't know what a midwife was. I didn't know what a doula was. My mom gave birth with like, she had no epidural, but she gave birth in the hospital every single time. Like that's what happened. You go to the hospital, you have a baby, and then you leave. And so
Right.
Can you speak to that a little bit, to the women that are like feeling the fear right now of like not knowing, oh, well, I was going to go to the hospital and now I'm being told that maybe I need to do a home birth. Is it safer? Is it not safer?
Right. So there's a couple pieces of this question. One is that I would never advise someone to make a decision based out of fear. So my home birth, my original choice to have a home birth was a little bit based out of fear because I was afraid of hospitals, the epidurals, the C-sections, you know, not having a voice. So I've had to learn personally to like make these choices out of empowered, evidence-based like resources, utilizing everything I have and making a decision based on what's best for me and my family. So to make a decision for a birth center or home birth out of fear, it's probably going to give you the same outcome that you would going to a hospital and being afraid too. So as far as safety, in the United States, the research is showing that birth center and hospital births have about the same outcome as far as maternal and fetal outcome, which is fantastic. Very little research is done on home births in the US, but outside of the US globally, home births also have really, really, really good results as far as maternal and fetal outcome. So the best thing about home birth and birth centers though, are that there's a lot less interventions used versus a hospital. So those are some huge points to quell some of the fear if someone is considering moving from a hospital to a home or birth center birth. So making that decision from an informed place is the most important. Don't make that decision out of fear. So I think I talked about the fear and the safety of it at this point. So was there any other part to that question I'm missing?
I don't think so. Was it?
No. I should have written it down in parts.
Sorry, I forgot that I had muted my. I was just like, yeah, you got it. And then I was like, oh wait, I'm muted. So yes, the next thing that I want to ask is, you answered that question perfectly and beautifully. And I asked that because I've had a lot of women who who are pregnant and they're having to make these changes, or they're being told that they should consider making these changes, which, by the way, I'm a 100% advocate that you make the choice you make with you and your partner. And like, that's the choice that needs to be respected. And that's the choice that needs to be advocated for. And so whatever choice you've made, just know that all three of us here on this podcast do support you through that. But I love what you were saying about research is saying and that the statistics are saying, and I don't think that that's talked about enough, about like the differences between those things and what does it look like in a home birth versus what does it look like in a hospital birth. And so can you speak on, because I get asked this a lot, like actually people will ask me, what is the difference between giving birth in the hospital versus giving birth at home? Like, what isn't being at home with less medical care? And can you speak on like what that looks like with a home birth?
Absolutely. So the biggest, not the biggest difference. So I'll talk about providers quickly. For a home birth, you're typically going to be provided by a MD, DO that specializes on OBGYN. You may have some nurse midwives attending the birth as well in a home birth. And the primary provider of home births are certified professional midwives. So they don't have a nursing degree typically, but they take the same course, the same certification as the nurse midwife does for their midwifery education. So they come bringing a lot of the same emergency tools that you would have in a hospital, as far as oxygen, sutures, some medications to help with hemorrhaging. So as far as safety goes, the midwives are trained to call for backup and call for transfer when needed. So they're there to support you, making sure that you're safe and making those hard decisions with you when transfer is necessary. In the US, the majority of transfers, though, are from maternal exhaustion, not from any safety related, like hemorrhage or baby stuck or baby's heart rate is changing. Mostly it's just maternal exhaustion. So they transfer to the hospital for some Pitocin or epidural or other drugs. As far as a home birth, you're definitely limited on the amount of drugs you can use for pain relief. So you're going to be doing a lot more homeopathic medicine, movement, water. Those are how you're going to manage your pain, versus in a traditional hospital setting, you're going to have the ability to have, some midwives do have the nitrous oxide, not all of them, but that's more available in the hospital along with epidurals, narcotics. So that's the biggest difference, I think, as far as management goes. But the biggest difference for me and why I chose a home birth is the comfort of your own home. You get to be the advocate, you get the majority of the voice, your opinion is very important, and you're not just treated as a number trying to get out of the labor ward and move to the maternal ward afterwards. So it's very much done on your own time. There's no time frames. There's some time frames as far as like legality is concerned for when you need to transfer, but it's just, I feel like midwifery care is much more evidence-based than you would find in a hospital, surprisingly. So I've noticed in a hospital setting, and this is my opinion, probably not statistically relevant, but that a lot of it's done based on this is how we do things versus using real evidence-based care. So time frame, they use antiquated, well, you should dilate by a centimeter every hour. When does that happen in real life? Does our cervix have a watch? I don't, mine doesn't anyway. I don't know. So I like being at home, taking walks in the neighborhood. I took my dog for a walk during my first home birth. I swam in my pool when I wasn't in active labor. So it was just definitely a lot more calm and comfortable setting. And I was able to eat. That's my biggest thing.
I was going to say, are you going to mention that you can eat at home?
All the
because
food.
Labor is a marathon, man. You need energy.
Absolutely. That's a big thing. I talked about it on one of my Instagram posts. Take your snacks, especially if you can't have your birth partner there, because that's my snack runner. Jeremy's my snack runner, my husband. And yeah, without him, take your own snacks because they will not give you them in the hospital. So.
They also, like, when I was there, when my sister ended up being in the hospital at the end of hers, like, water was an issue. Like, you can find water anywhere. Or, like, you'd have to ask a nurse who's busy, so they'd have to wait, like, hours. And you're like,
Right. Please just here's some ice chips.
Right.
Right.
Okay.
And that there's no evidence based on eating and drinking prior to like a emergency C-section. No evidence suggests that eating and drinking prior to that will have negative outcomes. So that's not an evidence-based practice being performed in hospitals. So just something that like these are important things to think about when you're thinking about what you want your birth to look like.
Mm-hmm.
So
what does a birth educator do? What do you do as a birth educator?
I'm still figuring it out.
Okay.
It's very evolving. At first, I was offering one-on-one coaching to create a birth vision, create a very customizable birth plan, and then updating that as the due date drew nearer for hospital, birth center, and home births. Right now, with everything going on, just offering women who would never have thought to even have a birth plan, easy to read birth plan graphics so that their providers can see what they want. If you're not allowed to have your doula there, having one less thing on your plate as far as advocating for yourself, just providing that tool for women has been important and a huge key in what I'm doing right now. Making sure that I speak out of a place of like providing evidence-based resources is important. And it just evolves, and it's evolved quickly over the last year just based on what's going on in our current economy and health in the United States and globally, honestly. So, I guess for me, it's mostly about empowering women with evidence-based resources. That way they have a voice going in and they know what they know.
Yeah.
That way the doctors can't intimidate them. So.
It was huge. So you talked a little bit about like kind of like what you do as a birth educator, but when somebody wants to work with you, what does that process kind of look like? Like you took them through like a little vision of that.
Yeah, absolutely. So if we're talking one of my like one-on-one coaching sessions, we're going to have an hour to 2 hour, it depends. The time limit's very flowy. Conversation, we're going to create your ideal birth vision. What I want is for women to feel empowered and educated and strong about their birth experience, pregnancy and birth experience. And at the end of it, not feel shame or disappointment around what happened. We can't plan a birth as much as we call it a birth plan. So it's more of a birth guide, but at the end of the day, making your decisions based on evidence, whether you do end up having an emergency C-section, and just knowing you feel good with that decision. So we'd have that conversation about what your ideal birth looks like, go over areas where you're not quite sure, interventions used, medicines used, positions even for pain management, alternative therapies for baby positioning. So just things that women might not have even known existed. So we'll go through that, create this really in-depth birth plan, and at the end of our conversation, and of course they'll have access to me for moving forward throughout their pregnancy, but we create a birth plan that they could take to their providers. That way they can have this open dialogue with their providers about what they want, what they're not open to, and that leads to more advocacy during their pregnancy and labor without them being super involved in the process. So they meaning the pregnancy, the pregnant woman. There we go. So that's kind of what it looks like.
That's really cool. It's interesting too, because I just got off the phone this morning before we hopped onto this podcast recording with a client who she's 5 weeks postpartum right now. And it was really cool to see her transition from her first pregnancy, having no birth plan, nobody to work with her, nobody educating her, telling her. And then going through the second one, she literally told me this morning, she was like, I felt so empowered through my entire labor and delivery because I knew all the things that could happen. I knew all of the options. I knew all of the information. I knew what the doctors were telling me. And I didn't feel that I was being pushed to do something I didn't want to do because I had my voice. And so being told that from women is so cool. And we love on this podcast to just empower everyone listening so that you understand that your voice matters more than anyone else's when you're delivering your baby, because it's your body, it is your choice, it's your baby, and you have the ability to be able to stand up for yourself. But there's people like us that are out here And like Dr. Marissa, who like, that's their job. That's what they do, is to advocate for you and give you those resources and that information so that you feel empowered and that you enjoy your birth. Because I don't remember who it was. We've done so many podcasts now, but there was somebody on a podcast that said like one thing about your pregnancy is the delivery. You always remember your birth story. It will be with you forever. And so it's really important that we set you up with everything that you need. Oh, sorry, we saw Dr. Marissa's child and he's all he's talking on the podcast in the background. He's agreeing with everything I say. I like that.
Absolutely.
But yeah, it's really, really important to know that you can like reach out and that we're all here for you, and to understand that your birth story is something that's going to be with you forever. So know the
Absolutely.
you go into those in-depth plans, know what to do if this happens, know like if you have to get transferred, what are your options there, what does all of that mean? Because what we don't want is for you to have a choice and then something change and it have to change and you don't understand what they're telling you. So make sure that you know that information. I love that you're making that evidence-based as well. That's really, really cool. So can you tell our listeners though that are listening and they're like, wow, I really want to follow her. I want to learn about her. I want to know more about what she does. Can you tell people how to find you?
Yeah, absolutely. So right now my Instagram is where you're going to find the most information. It's Dr. Marissa Holes on Instagram is my handle. There's a lot of great resources there. There's some free resources linked from my Instagram to my website. But it's a Wix website, so I don't know the URL currently. So go to my Instagram, click on the link, and you can find some free resources. Right now, my two favorite free resources that I have up there are some safer swaps for pregnancy and postpartum. They're just clean, non-toxic, hormone-friendly, baby-friendly. These are things you can like slather on your kids. They can eat it, and they're going to be fine. So
Yes.
very important.
I love that.
Yeah, so that's up there. They're great little resources. And then, of course, I'm here to support anyone if they have questions about that or questions about anything. And then my other favorite resource is I have a video up on YouTube that's in my like link tree on Instagram, and it's about knowing your options. So I go over a lot of the options for pregnancy and for birth. So I even talk a little bit about VBAC, C-sections. So no matter what your birth path is, I've got you covered. So that's one of my favorite resources right now. So
yeah, and I can speak to that too. I've actually watched your video and it is very informative and I love it.
Thank
and I actually
you.
send clients to watch it a lot because it's like I don't have to recreate the wheel, so I just send them to your video because you already say it all and you know much more about that than I do because I'm not in the delivering baby. I'm taking care of mom mode. I love sending people away to be able to know that because it's nice. That one video, I urge everyone in here who is either considering being pregnant at some point in your life, being pregnant right now, or have been pregnant before, go ahead and go watch the video. It was really empowering to know because then you can walk away knowing what all of those terms mean. Because I think a lot of times we're following people on social media, we're listening to our OBGYN or our doctors, and we're learning all this information, but we don't really know how to empower ourselves to get the information that we need. It's important to go watch that video. It's a really, really fun time. So yeah, but awesome. Thank you so much.
yeah, thanks for inviting me. I feel like I talked to your guys' ear off, but
I love talking to you anytime I talk to you about birth. It's great.
it's a lot of
I love
fun.
talking about that stuff. Everybody that knows me knows I talk a lot anyways. That's one of the like normal consensuses from this podcast is, Kaylee, you talk a lot. And I'm like, yes.
Sure do.
This is the true story. But no, thank you so much. Everybody, please go follow Dr. Marissa. She's a wealth of knowledge. She has so much good information. And if you ever just want to have a conversation that you're going to laugh like and cry and feel amazing at the same time, like she's an awesome human being. I love having her in our circle. And yeah, but we're super excited that you came on, and I'm ready to reach out and ask you questions and learn from you. But until next time, everybody, Vaginas and Vertebrae, we'll see you next week.
Yay!